Get back to your question, what that means for a Canadian drug agency. Certainly when I was at CADIF and all the discussion about National Pharmacare and the Canadian Drug Agency and a separate PCPA body, all of these questions were out there and the role of PMPRB. I made it very clear to the politicians and the senior officials, both provincial and federal and territorial, that we will respond to whatever system you put in place. If you were to put in place a single payer system, we will respond to that and develop the appropriate services and programs and policies to meet and support your needs. If you want a fill the gap system, we will adapt and ensure that we deliver the support to all of the different stakeholders involved there. Likely, if it's a fill the gap system, there probably needs to be a closer relationship between the insurance companies and this Canadian Drug Agency.
Got it. No, thank you very much for that. So, from my just rudimentary understanding, then Sangmi pointed out one thing is, depending on which one, that could impact negotiation. Actually, that makes a lot of sense. And then Sangmi also brought up this concept of eligibility. Like if you did fill the gap, then in some ways you have to determine like eligibility, and I assume that may fall under the remit of CDA. Like we're just making stuff up now, right? This is just all we should have said this in the beginning. Disclosure: these are just opinions. These are not like we don't none of the guests nor ourselves know for a fact what will happen, but these are our opinions. And eligibility, you just assume that someone like the CDA would have to kind of manage what that means, and then also manage the relationships with the insurers. That's what you mean, though, by that, right, Brian?
Absolutely. Not just the insurers, but also with the other organizations that are involved in managing pharmaceuticals, the Pan-Canadian Pharmaceutical Alliance, ensuring it has what it needs to negotiate prices with pharmaceutical companies, with the PMPRB, with whoever is involved with managing pharmaceuticals in Canada. This Canadian Drug Agency will need to provide adequate support.